Yes, Sachin sir, over to you, sir. His screen is visible?
Not sir, not visible.
Just a minute. I'll show. Now, sir.
No sir.
Yes, sir, I have already shared the screen. Please.
Also,
Now, sir, it is visible.
no sir, not at all.
Dear participants, you can
Ah,
see the same
yes sir.
slide. Now, sir.
Yes sir. Shall I start, sir?
Yeah, sir. Please.
Good afternoon to all participants. I think you all are enjoying the training sessions of diabetes. Today we have Indian speaker, Mr. Vishal. Sir is assistant professor at Bharati Vidyapith College of Nursing, Sangli. Sir has completed BSc in RGHS, Bangalore. Sir did MSc from Bharati Vidyapith College of Nursing, Sangli. Sir is uh, sir has experience in and clinical. Sir has research grade for PG and UG students. Sir working in video since from 2017. Sir published research papers in national and international journals, including Scopus, Web Science, and UGC research journals. Sir has expertise for medical conferences, worked as examiner and director for various universities. Sir has worked as Indian in Industry Council, Germany, or GHTM.
Thank you, sir. Thank you for the introduction. Am I audible to you all? Yes, can anyone tell me? Am I audible? Govinda?
Yes, sir. Yes, sir.
Thank you. Thank you. So that I'll share the screen now. Yes, the screen is visible now.
Yes.
Yes. So the screen is visible now.
Yes, sir.
Sachin sir.
Yes, sir, visible.
Yes, thank you. So today we are going to discuss about the exercise, especially on exercise in diabetes. So before starting with the exercise in diabetes, already we have finished with the sessions like diet, medication, and next is exercise. These three parts are very important in diabetes management. So exercise is one of the important factor. So here you can you can educate the diabetes patients by doing exercise in day-to-day life. You can manage the session. So you can manage the diabetes. So here exercise. First we'll talk about the exercise and then we'll talk about the exercise in diabetes. the importance of exercise in diabetes. So you all know that it is the regular activity may prevent or delay the diabetes and its complications, and exercise along with the diet, medication, and education. These forms the four pillar of diabetic management. We always go with the diet, medication, and exercise. And main important part is about three pillars, about three factors you need to educate the diabetic patients. So these are the four pillars of diabetic management. So being active is an important part of being healthy. You all know that you need to be very healthy. So that you need to do the exercise. Exercise is not only means the strenuous workout you are going to do in gym. It's not that. It's by simple walk for 30 minutes a day can also be considered as an exercise. See, exercise if done correctly as advised by the doctors, by the trainers, so it has an immense benefit in diabetes in terms of positive effect on physical fitness, morbidity, and mortality. See, this is about the exercise, the importance of exercise. So now we are going to discuss, so exercise in diabetes. What is the importance of exercise in diabetes? See, it has been known since from long time that physical exercise has a positive impact on diabetes. If you do regular activities or you are being active in your day-to-day life, it has a cornerstone for the management of diabetes. Due to increased activity, the cell, if you do day-to-day activity or exercise, so your cells become more sensitive to insulin so that it can work more efficiently, and also that cells remove the glucose from the blood during exercise. So that's how it is going to benefit for the diabetes patients. The exercise is going to benefit for the diabetes patients. Hence, exercising consistently can lower the blood glucose level and improve the glycated hemoglobin, that is lowering the HbA1c. So that is very important. HbA1c is very important. That allows reduction in number of diabetic medication, and also you can exclude from the insulin. Okay. Unfortunately, majority of the peoples with the diabetes do not engage in their regular exercise. That's why they face the many complications with the diabetes. That's why today we are going to deal with the exercise, the importance of exercise in diabetic management. As a nurse, you need to educate them whenever patient comes to you with the any diabetes, so you need to educate them how it is going to manage to prevent the further complications. So one by one we are going to discuss today. Am I audible to you all? Yes, am I audible?
Yes, sir. Yes, sir. Audible.
Yes, sir. Yes, sir.
Sir.
So as a nurses, the participants are nurses. Why nurses are vital in the global fight against the diabetes? So this is very important. See here, the global prevalence of diabetes continues to grow. With the recent estimate from the International Diabetes Federation, it is showing that 1 in 11 adults, see, so 1 in 11 adults are living with the condition. It is crucial there are enough nurses and allied health professionals to support people living with the diabetes. So in recently in 2022, the International Diabetic Federation shows that there is a high rate of prevalence in the diabetes. So that is the concern area. So also the WHO report says that there is a shortfall of 5.9 million nurses, potentially leaving millions of people, those who are lacking the care they need. So exactly that's why we are training for the nurses by Eco India with the collaboration with the Eco India. So without swift action, people living with the diabetes are at high risk of developing the conditions, will be more vulnerable to the life-changing complications like macro complications and micro complications. In previous sessions you have heard. These high risk of developing these conditions will more vulnerable of life-threatening conditions, the associated complications. So such as heart stroke, loss of vision, kidney disease, and lower limb amputations. Okay, these are associated condition with developing with the diabetes. So to mark the WHO Year of the Nurse, Indian International Diabetic Federation is urging all the governments, all the countries of the government and healthcare organization to invest not only in the recruitment for more nurses, but also in their training. So nurses can provide best possible support to living with the diabetes so that it can manage the diabetics. So this is how, why the vital why vital for the nurses to fight against this disease. Okay. So next, just a minute. Next, throughout the session, we have specific objectives. So at the end of the session, you are going to complete with these objectives to make the patient understand the importance of exercise in prevention and management of the diabetes. Second objective, to discuss the health benefits of the physical activities. And third objective, to create awareness about how to use the different exercise modalities. So we'll go with the introductions. As I already told you, how important, how benefits these exercise in diabetic management. Diabetes mellitus leads to macrovascular and microvascular complication in day-to-day life. So resulting in life-threatening condition, exercise is considered as an important therapeutic regimen for the diabetes mellitus. So that's why exercise in patient with the diabetes mellitus, it can promote the cardiovascular benefits by reducing the cardiovascular risk. So, and mortality and assist with the weight management. And it improves the glycemic control. There are added benefits for the people with the diabetes. Exercise also lowers the blood glucose level and boosts your body sensitivity to insulin by the cell oxygenation, countering insulin resistance. That's why it is very important in diabetic management. It is a cornerstone of diabetic management. The exercise part is cornerstone of the diabetic management. So there are many studies which have shown there are benefits of exercise. Following are some highlights of these results. There are many studies have shown that yes, exercise is have a immense benefits in diabetic management. So there are some studies which I have taken. Exercise lowered the HbA1c values by 0.7 percentage point in people with the different ethnic groups with the diabetes, weight, taking different medication and following variety of diet. Yes. So all forms of exercise, aerobic resistance exercise, like anaerobic exercise, or doing both combination training were equally good at lowering HbA1c values in people with diabetes. We are going to discuss about what are the types of exercise that diabetes patient may do. So there are many different types of exercise that you are going to advise the patients to manage the diabetes. So resistance training and aerobic exercise both help the lower insulin resistance previously sedentary older adults with the abnormal obesity at risk for the diabetes. Yes, so people with the diabetes who walked at least 2 hours a week were less likely to die of heart disease than their sedentary counterparts. And also those who have exercised 3 to 4 hours week cut their risk even more. See, there are some studies which are showing that there are less complication those who are doing exercise. Yes, it has immense effect on the diabetes management. Exercise have many effects. So women with the diabetes who spend at least 4 hours a week doing moderate exercise, including simple walking or vigorous exercise, had 40% of lower risk of developing heart disease than those who didn't exercise. So these are some many studies which have shown that there are benefits of doing these kinds of exercise to manage the diabetes. So we'll go one by one. So first we'll role of nurses. So here, what is your role when you manage the diabetic patient, when you face the diabetic patients? What is your role? The nurses are very important in managing the diabetes. So that's why we are taking sessions on you. So how to manage those, how to give health education, how to motivate them to do exercises. So these things you are going to develop at the end of the session. So first is role of nurses. So role of nurses, first one, to highlight the importance of exercise as a part of mainstream therapy, your first role. And second role is to motivate the patient to take a physical activity voluntarily. And third one, answer the patient queries related to exercise in diabetes management. And fourth one, to discuss precautions prior to undertaking the exercise. So here you need to go with this role. First one is highlight the importance of exercise as a part of mainstream therapy. Before you are educating to diabetic patients about exercise, you need to highlight the importance of exercise. then only they will motivate by doing the exercise. Otherwise, if you just educate them by superficially, they are not going to get motivated with that education, so they are not going to continue or consistency in their doing their exercises. So that's why first objective is very important, first role is very important, to motivate the patient to take a physical activity voluntarily. No need to force them. Voluntarily, you just motivate them to take up the physical activities in their day-to-day life. So answer the patient queries related to exercise endeavor. How many patients comes with the many complaints, like if they are having micro complication, macro complications. If the patients are having macro and micro complications, yes, those patients need a doctor's prescription of what kind of exercise they must do. So without that, the patient cannot do the exercise. So if with the concerns of doctor, they may add as advised by doctors, they can do their exercise. That we are going to discuss later. So to discuss the precautions prior to undertaking exercise, that is what the pre-assessment what we have to do. So pre-assessment of nurses, or pre-assessment of diabetic patients by the nurses. Okay, so that these things are very important. This is your role in managing the diabetes when you are educating them about exercise. So you also know that exercise is along with the diet, medication, and education of the four pillar I told you in the beginning. So these are the four pillars of diabetic management, and being active is an important part of being healthy. So exercise does not only mean strenuous workout in the gym. It is by simple walk, day to day life. You simple walk for 30 minutes day can also be considered as a exercise. If it is done properly as advised by trainer, exercise will have an immense benefit with the people with the diabetes. That is what we need to educate them. So overall benefits of the exercise. Overall benefits are very important. Overall benefits in that improves cardiovascular health. It improves the cardiovascular health. How it is going to improve the cardiovascular health? By regular exercise. Okay, by regular exercise, your heart will be more stronger and the lungs will be more fitter. So that you need to teach them how it is going to improve the cardiovascular health by the stronger heart and the fitter lung. Reduce weight. Weight is along with the diet, you need to maintain the weight also. So how you are going to educate them? So exercise along with the diet and behavioral changes helps in weight loss and maintaining the weight control of every individual. That is very important. It reduces the weight. Okay, and improves the blood cholesterol level and blood pressure level also. Along with the blood cholesterol level also, it will improve the blood pressure level. Improves the sleep and quality of life. Improve the sleep and quality of life by reducing the stress of the patients, by reducing the stress of the patients and improve the self-esteem. Okay, this how the overall benefits of exercise. And next, reduce the stress, improves self-esteem, improve the physical fitness and stamina, prevents coronary artery diseases, osteoporosis, diabetes, and it is inexpensive and free of side effects. These are the overall benefits of a exercise. Next is benefits of exercise in diabetes. So overall benefits is different, and especially in diabetics, what are the exercise benefits are different. So benefits of exercise in diabetes: regular exercise helps in maintaining the blood glucose level, that you all know. Inducing weight loss, improves insulin sensitivity, okay, and improves the glucose utilization by the body. So exercise is very important in managing type 2 diabetes and type 2 diabetes mellitus, because it helps in managing the associated glucose lipid, blood pressure abnormalities as well. Okay, and weight loss also, and weight maintenance. So that's why regular exercise helps in maintaining blood glucose level and decrease the glucose production from the liver. And also it decreases the glucose production from the liver, and also it decreases the circulating insulin level by giving sensitized to particular cells. Okay, how it is going to reduce the how it is going to decrease the circulating insulin level by sensitizing the cell. So one can achieve good control of blood sugar level with the low dose of oral antibiotic drugs. Okay. Also, the drugs also very important in diabetes. So next, before educating the nurses, you need to do the pre-exercise assessment. Before giving any advice, before giving any exercise advice to any diabetic patients, you need to do the pre-exercise assessment. That is very important. What is the importance of doing these pre-exercise assessment? See, assessment is very important. It usually it is a pattern of how what activity you are going to do and how you are going to do, how many times you are going to do. It is a prescription of giving exercise, prescription or exercise program. You are going to educate them according to individual difference. The people with the diabetes should undergo detailed medical evaluation before giving any exercise program to that diabetes patient with appropriate diagnostic test. Okay, the assessment should aim at screening for the presence of macrovascular and microvascular complications, because that may be worsened by the exercise program. It is particularly important for the patients who have not been recently physically active. So that's why you need to find that what are the patient's macrovascular and microvascular problems. So according to that, you're going to give the exercise program for the patients. Okay, so next is in that detailed physical examination, medical history, evaluation, and laboratory investigation should be performed to verify the following things, like for example, patient's blood glucose control, whether patient's cardiac functions are stable, whether the normal kidney functions are normal, within the normal range they are working. So absence of retinopathy, healthy feet, whether you need to check the patient's feet, whether patient's feet are healthy or not. These are identification areas of concern will allow the design of individualized exercise program. So because why we need to do this, because we need to minimize the risk of the patient. So that's why the pre-assessment, pre-exercise assessment is very important in the day-to-day life when you are managing the diabetic patient. There are various tests for the cardiac assessment. So why we need to do the cardiac assessment? Because cardiac assessment is very important to know the patient's cardiac conditions. To prevent the further complication, we need to check that whether patient is fit with the cardiac functions or not. There are some cardiac function assessments are there, like for example, blood pressure you are going to measure. Blood pressure is one thing. Second one is lipid profile and resting electrocardiogram, like resting ECG you need to take, and stress test. Like we always take that in the cardiac ward, cardiac emergency units, like a stress test, like treadmill test, what we call it as. These tests are to whether the patient has a normal cardiac functions. Before doing any before giving any exercise program, you need to do these assessments. So that is the importance of only why we do the exercise assessment. Patient is having any micro or macrovascular complications. If they are having macro and microvascular complications, to prevent further complication, we need to do these things. So according to the individual capacity, according to the individual exertion, so you need to give the exercise program to the patients. That is very important. Next, types of exercises. There are various types of exercises which are available. Like there are mainly three types: aerobic exercise, anaerobic exercise is also called as resistance exercise, and the flexibility. These three exercises are very important in day-to-day life. You need to educate them about these types of exercise. Types of exercise, first comes aerobic exercise. Aerobic exercise, the name itself says that aerobic exercise, here the large muscle groups which are involved in the patient's exercise. So that's why when the large group of muscle are performing, so that time that large group of muscle need oxygen. So that's why aerobic exercise are very important to tell the patients, because these aerobic exercise are improves the insulin sensitivity and reduce the body fat. So how it is going to control the glycemic in their particular patient's body. So aerobic exercises, for example, like walking, cycling, swimming, running, cross training, dancing. Okay, these all are aerobic exercise. These aerobic exercise uses large muscle, can be performed safely to offer best result for type 2 diabetic mellitus patients. And also it improves, as I told you, it also improves the insulin sensitivity and reduces the body fat and improves the glycemic control. So next is resistance activities, like resistance exercise. Like resistance exercise, what we do in the strenuous exercise in the gym, those are anaerobic. So here, what are those resistance exercise? Resistance exercises are using large group of muscles that do not require oxygen for the short period of time. As we require oxygen for in aerobic exercise, in the same way here in anaerobic exercise, you are using large group of muscles, so that do not require any oxygen for the short period of exercise. Resistance exercise improve the muscular strength. For muscular strength, we do these anaerobic exercises. So yes, the muscular exercise also have an immense effect of controlling the glucose. So it will utilize the glucose level in the body by using these resistance exercise. Resistance exercise, like for example, weightlifting, push-up, pull-ups, these kinds of resistance exercise, anaerobic exercise will improve muscular strength and stamina. So while doing all these exercise, I want to tell you that this is my experience when I do exercise. So if you want to effect those exercise, what you are doing, any anaerobic exercise, aerobic exercise, any flexible exercise, so your breathing pattern is maintained. You need to control over your breathing pattern. So breathing pattern is very important. So resistance, next is flexibility. Helps by reducing the possibility of injury related to exercises. So also it reduces the stress and improves the insulin sensitivity. So flexibility exercise, see, they may help you reducing possibility of injury related to the exercise. And also it will lower the counter regulatory hormones. They also improve the insulin sensitivity and thereby lowering the blood glucose level is very important. By doing this flexibility exercise, yes, definitely it helps to reduce the possibility of injuries. So along with that, it reduces the stress and improves the insulin sensitivity. Like for example, yoga, okay, stretching, these are the flexibility exercise. See, as a nurses, you should know that what do you mean by aerobic exercise, what do you mean by anaerobic exercise. Like that is a resistance exercise, like weightlifting, push-ups, pull-ups, what we do in the gym, those are the strenuous workout. And next is flexibility. Flexibilities also have a effect on patients with the diabetes. Next is, there are some energy consumption of various exercise with the kilocalories. Like for example, 30 minutes of following exercise, we have given one column like 30 minutes of following exercise, and 55 kg person, how many kilocalorie it is going to burn with the 30-minute exercise, and 70 kg, how many kilocalories that person is going to burn. 83 kg person, how many kilocalories by doing 30 minutes of following exercise, how many kilocalories he is going to burn. Like for example, first one, weightlifting in general, 55 kg, 55 kg person will burn 90 kilocalories. 70 kg persons will burn 112 kilocalories, and 83 kg persons 133 kilocalories. And step machines, like for example, 30 minutes of 30 minutes you are doing a stair steps machine. So that time 55 kg person will reduce the kilocalories of 180, and 70 kg to 23, 83 kg person will reduce the 266. Like weightlifting, you're doing vigorous weightlifting, that time 55 kg person will reduce the you will burn the kilocalories like 180, 70 kg person 223, 83 kg person 266. And aerobic exercise, just now I told you, like running, cycling, swimming. Aerobic exercise, like aerobic exercise steps, that is have low impact. So 55 kg person will burn kilocalorie like 210 kilocalories, 70 kg person 260, and 83% 311. Next is aerobics high impact. If you are doing with the high impact aerobic exercises, that time 55 kg 55 kg persons will burn the 210 kilocalories, 70 kg 260, and 83 kg 311 again. So aerobics steps high impact. Like same with the 300, 372 and 444. Bicycling, that is stationary vigorous, 315 kilocalories, 391 kilocalories in the 70 kg persons and 466 in the 83 kg persons. Walk for 5 to 6 kilometers per 10 minutes per kilometer. Okay, so 120 with the 55 kg persons, 120 and 220 for 149 with the 70 kg person and 83 kg 83 kg persons with the 178 kilocalories. Swimming in general 180, 223, 266. Walk, jog or below less than 10 minutes you are jogging. So 55 kg persons, 180 kilocalories, 223 with the 70 kg persons and 266 kilocalories with the 83 kg persons. Okay, bicycling 19 to 22 kilometer per hour, 240 in 55 kg persons, 298 in 70 kg persons, 355 in 83 kg persons, and running for 8 to 4 kilometer, 8.4 kilometer per hour. Okay, 7 minutes per kilometer. So 270 kilocalories will burn with the 55 kg persons, 70 kg persons 335 and 83 kg persons 400. It is energy consumption of various exercises. We always count the calories burned. So this how by doing 30 minutes of following exercise, how that person is going to burn their calories. So these are the calorie burning things. So next is pursued exertion. Yes, this is very important. When you give any exercise program to diabetic patients, exertion of the patients, you need to understand the pursued exertion. So that will interact between the body and mind. So if the body and mind is interacting with the exercise, then only that exercise has a effect. Then only that exercise has a benefit. So here you need to do is pursued exercise reflect in the interaction between the body and mind. The psychological parameter has been linked to many physiological events that occur during physical exercise. Like for example, so ratings of pursued exercise can be used, prescribe, monitor exercise intensity during the workout. There is one scale, that is RPE scale, rating of pursued exertion. That person exertion you're going to measure by using this scale, which ranges from 6 to 20. Minimum is 6, maximum is 20 ratings. So it helps individual in safe exercise intensity, personalized exercise plan, monitoring and adjusting improves compliance. So if you are giving any exercise program to patients, before giving any exercise program to patients, you need to check the patient's exertion by using this BORG rating scale. That is rating pursued exertion scale. Okay, this is very important. Pursued exertion is valuable tool in the holistic management of diabetes because it reduces the compliance from the patients after giving any exercise program to the patients. It empowers the patients to monitor and control their physical activity, so leading to better health outcome and improve the quality of life. See, this is how the pursued exertion you need to understand as a nurses. Whenever patient comes to you with the diabetic management, then you are going to give any exercise program to them, you need to check the Borg scale of that particular patient about their pursued exertion. You need to understand to prevent the complications. Next, exercise recommendations. So all individuals, including people with the diabetes, to limit the amount of time being spent sedentary sittings, about 90 minutes, to break up extended amount of sitting time. You need to do this exercise recommendation. So children and adolescents with the type 1, type 2 diabetes or pre-diabetes should engage in 60 minutes per day or more of moderate or vigorous intensity aerobic activities with vigorous muscle strengthening and bone strengthening activities at least for 3 days a week. Most adults with the type 1 and type 2 diabetic should engage in 150 minutes or more of moderate to vigorous intensity aerobic activity per week, spread over at least 3 days per week with no more than 2 consecutive days without any activities. Okay. Shorter duration, minimum 75 minutes per week of vigorous intensity or interval training may be sufficient for younger and more physical fit individual. The patients who are fit and more younger, For that patients, it is very important. The vigorous intensity or interval training may be sufficient for those types of diabetic patients. This is about exercise recommendations. How we are going to recommend the exercise for children and adults with the type 1 diabetes. Okay, this you need to check all these things. Next, before giving any health exercise program, you need to set a realistic exercise goals. Okay, you need to set realistic exercise goals, like help people find a way to start. Goals should be like specific, measurable, achievable, realistic, and time. With this realistic goal only, they will motivate to do the exercise and they will maintain the consistency of doing exercise. So this is very important, setting the realistic goal. So any exercise program, if you want to success a program of exercise, you need to give this, start with the SMART work. Okay, we call it as a SMART, SMART, SMART. S stands for specific, M stands for measurable, A stands for achievable, R stands for realistic, and T stands for time. So here we should be very specific to this realistic goal. So goal should be specific, measurable. First one is specific. It is exactly what they will do. You need to give them exactly what exercise you are going to do. Measurable, how long and how often. Huh? How long you are going to do that and how often you are going to do that. 3 times, 2 times, 1 times. Okay. So achievable, the person thinks he or she can do it, but you need to see the exertion also. By after checking exertion rating scale, then only you are going to give that patient what type of achievable exercise that individual can do. Next is realistic. Realistic is appropriate for individual's fitness level. How? Whether it is after pre-assessment. Here, after the pre-exercise assessment, you need to give exactly according to the individual fitness level. That is what realistic. Next is time. State when they will start. The timing of the exercise. State that when that exercise program that person, that individual diabetic patient can do. Encourage people to reward themselves when the goals are met. Whenever goals are met, you need to encourage them by giving any simple suggestions by activity, with such as like when you are going to go with the shopping park or for the end of the parking lot. Okay, walk instead of going by car, cleaning the house, walking up in the light, or flight of stairs instead of talking of the elevator. So these are some various tips which you need to give to the patients. You need to give set a realistic goals for the patient. There are some tips to help start the physical activities. Identify activity that will be enjoyed. You need to take the history of the patients, whether the patient is able to do that. Patient is whether you are giving exercise program, that exercise program that patient may enjoy that. Okay, start slowly, perhaps 5 to 10 minutes at a time. Increase the duration and intensity of slowly, and consider doing exercise in a group or with the partner, and prevent boredom by varying the activities. So it is very important to warm up before exercise for 5 to 10 minutes, and low intensity walk and gentle stretching. Before doing any activity, any exercise, any exerciseal activity, you need to do the warm up exercise. So that by this you need to reduce the compliance of the patients from the exercise activities. After exercise, it is very important to cool down for 5 to 10 minutes for low intensity work and gentle stretching they can do. This is how you need to give tips to the patient. It is very important to give tips, because physical activity is very important. So it should be safe and it should be enjoyable for the person with the diabetes. So that's why we need to give these tips. Next, tips for starting exercise. For starting exercise, you need to give some tips. There are various tips to start the exercise. Drink adequate amounts of water. The water is very important part. So you need to educate the. Just a minute. You need to educate the patients about drinking of water. What is the importance of water? Ensure that footwear is appropriate to protect the feet from any injury and keep them dry. because the complication may occur further. So we have some form of diabetes identification such as bracelet or carry an ID card. And next, ensure the exercise partners know how to recognize and treat the hypoglycemia. Before doing any exercise, if the patient is with any complications, you need to check these whether patient is in hypoglycemia or in hypoglycemia. So always carry some carbohydrate food and do not exercise when sick if blood sugar level are more than 300 mg per deciliter. So these are the tips before starting exercise. You need to educate them. You need to give them these tips for diabetic patients. And there are some special consideration with the hypoglycemia. As I told you about macro and micro complications. Hypoglycemia, blood glucose level. If the patient's blood glucose level 70 mg per dl, patient is in hypoglycemia. So that time blood glucose monitoring before and following exercise is very important, because a concern in individual on insulin, why there is a less than 70, why a patient is in insulin or what, and common symptoms which includes like patient is getting weakness, abnormal sweating, anxiety, tingling of mouth and hunger, that you need to check. During exercise, advise the patient carbohydrate snacks readily available. These things are very important when patient with the hypoglycemia. Next is special consideration of hyperglycemia. This is also very important. Blood glucose monitoring before and following exercise is very important. So common symptoms in hyperglycemia are polyuria, increased thirst, weakness, fatigue, and acetone breath. And exercise should be avoided if fasting glucose level more than 250 and ketoacidosis is present more than 300 with the without ketones. Just a minute, Sachin sir, please charger घेतात बघा. And also dehydration resulting from the polyuria, common response of hyperglycemia, leads to compromised thermoregulatory responses. Next is to advise drinking water. I told you about giving tips. Drinking water every 20 to 30 minutes during exercise, especially if it is hot and humid condition. It is very important. Patient be hydrated. Just for 1 minute. Just give me 2 minutes. Yes. This is about hyperglycemia we talked. And next is special population in nephropathy. The patient with the nephropathy complications. So that time you have to reduce the capacity of exercise, because the why we need to reduce the capacity of exercise, because there are some reasons. So the patient may get many complications with that nephropathy things. So here you need to give some, you need to recommend the low to moderate intensity forms of exercise. So contraindicated high intensity forms of exercise is contraindicated in the nephropathy patients. Next, special population like nephropathy, these patients suffer loss of protective sensation in feet. So repetitive exercise on insensitive feet can lead to ulceration and fracture. Use proper footwear Moisturize feet regularly. Okay, these are the special consideration with the nephropathy. Recommended is non-weight bearing activities, swimming, cycling, and rowing, chair and arm exercise. And contraindicated like for example, treadmill, prolonged walking, jogging, step exercises, running. These things are contraindicated with the nephropathy diabetic patients. And special populations like retinopathy. Eye examination is necessary for every individual with the diabetes to understand the retinopathy. Intense exercise will cause retinal damage. So that's why here also in retinopathy patients, you need to give a low impact exercises. Like recommended exercises are low impact cardiovascular conditions such as swimming, walking, low impact aerobics, stationary cycling, endurance exercises. And contraindicated exercises are weightlifting, jogging, high impact aerobics, and isometric exercise and request sports. Next, special populations like elderly, especially with diabetes with the elderly people. So older individuals have diminished strength of flexibility of their own. So that's time they usually have a comorbid conditions like cardiovascular diseases, peripheral arterial diseases, osteoporosis, obesity. In this condition, you need to give some you need to give some low strengthening and low flexibility exercises to prevent further compliance from the exercise program. So recommended exercise programs are low intensity, short duration aerobic exercise, non-weight bearing aerobic exercise may be required. Frequency aerobic of 3 days per week. Alternate days you can give resistance 2 days per week. Okay, equipments modification should be there in their exercise program. So contraindicators are jumping, jogging, sit-ups. These things are should not be there. These are the vigorous movement exercise. If the patient is elderly people. So special population like obese individuals, weight loss due to exercise along with the calorie control diet plan will benefit these populations. So that's why whenever you educate, whenever you give exercise programs to obese patients, that excess abdominal fat is associated with the many metabolic abnormalities. So that time you need to give different kinds of exercise, like what type of recommendation exercise recommendations, like maximum calorie expenditure 300 to 500 kilocalorie per day, walking within the tolerate limit, non-weight bearing activities, increase in duration rather than the intensity, resistance training along with the aerobics. Target weight loss 5 to 10% of the weight in initial 3 to 6 months. The contraindicated exercises are high intensity exercise, history of any osteoarthritis like avoid long walks, cycling, and over exercising. There are some starter walking plan. So in the beginning also I told you doing exercise is not a strenuous workout. When you are going to gym and you are doing exercise, that's not the exercise. By simple walk for 30 minutes a day is also very important. Start out by keeping track how much you currently walk for few days. Use pedometer, or nowadays we use smart watches to determine how many minutes of walking you already do, how many steps you taken from there to here. So you can follow some of these plans and more walking in routines. You can plan the walking routine. So daily start out slow. First you need to start out slow, increase a brisk walk, and then cool down with the slow walk at the end. This is how you need to do the daily walking activities. See, first week you need to do 5 minutes, 500 steps. So again you can just start a second week 5 to 500 minutes, like that. You can brisk walking, you can start 5, that minutes should be increased day to days. Today you are work for 5 minutes, tomorrow you can just work for 8 minutes. Like you can increase your minutes and steps also. By that totally you are going to just increase your walking plan. So you can improve your strength, you can improve your oxygen level in your body, so that your cells will get sensitized to your particular insulin, so that their blood glucose level will maintain. So remember that at the rate at which you increase your walking may be faster than or not as fast as the plan suggests. What's important is that you take it only one day at a time and build up your walking stamina at a pace that comfortable for you. Okay, this how, that's why they have given this chart. So that American Diabetic Association has given the walking chart, so that by using this walking chart, by educating the diabetic patients about this walking chart, we can just maintain their glucose level in their bodies. So role of yoga in diabetes, this is very important. Role of yoga in the practice of yoga is promising adjuvant for diabetes management along with the exercise. So diabetes related to physiological effects of yoga are reduction in HbA1c level, total cholesterol level, blood pressure and heart rate, reducing the body weight. So practice of medication when done along with the exercise, that relieves the stress, depression and anxiety. So that's why yoga is very important. So improvement in patients' attitude and self-control. When you want to control your mind, so you need to do the yoga. So that you need to educate the diabetes patient. So asanas, there are some following asanas which I have given. So talasana, vakrasana, kanasana. So there are some vasanas for the yoga sessions. With these yoga sessions, the patient's body and mind will get control. So maintenance of exercise programs. Apart from developing a safe exercise program, considering precautions, the following factors will ensure the adherence. So there is a requirement of special facilities like equipments, training program, people support. That is very important to maintain the consistency in your exercise program. Suitability with the lifestyle, okay, the timing of the exercise, affordability, whether the patient, you need to consider the patient's socioeconomic status also. If you are going to give any hi-fi exercise program, that patient is not going to afford for that exercise program. Avoidance of injury, okay, good partner, gadget applications like for example German watch, pedometers, fitness mobile applications like Runkeeper, Endomondo. So these are some gadgets or applications nowadays that exercise with the exercise program they are using. Next, this is the summary of what we discussed till now. So regular exercise is a key determinants of glycemic control that you all know. This is very important. Exercise is not only helps to improve the diabetes but also enhance the quality of life. Not with the diabetes, patient with any, irrespective of any individuals, they can do their exercise to be fit and to be healthy. So exercise not only helps to improve the diabetes, that enhance the quality of life. Weight training increase the insulin sensitivity, that strengthens the muscle, reduce the obesity and cardiovascular risk. Special precautions should be taken in people with the diabetes with the associated comorbidities, that you need to consider here. So that I told you in the beginning itself. So microvascular complications are to be considered, and associated comorbidities. Whenever you give any exercise program to your patients, so you need to consider this. Yoga is emerging as an important adjuvant therapy in diabetes with the numerous health benefits. This is about exercise and importance of exercise in diabetic management. Yes, there are some scenario I want to discuss. There is one scenario. So XYZ is a 21-year-old boy with the type 1 diabetes mellitus. His blood glucose level are not under control for the past few months. He wanted to start gymming as he had heard exercise will help in controlling his blood glucose level. He has come to visit the diabetic educator as a nurse, you. So that time you need to, you are going to ask, hello, how may I help you? So that he may answer you back like, hi, my blood glucose levels are not under control. They're always in 200 and 300 range. I want to start exercise to bring my blood glucose level under control. I have heard that exercise helps in controlling the blood glucose level. So that time, as a nurse, you are going to reply, yes, exercise plays a very important role in controlling blood glucose level, but you should not exercise if your blood glucose level are above 250 mg. 250 mg. So XYZ, who, why? So nurses, you can explain this. This is because about 250 mg, ketosis has started and the body is under stress. Exercising at this level will further increase the blood glucose level and stress on the body. So that's why you need to consult the doctors, and according to the doctor's prescription, according to the as doctor advice, so you can they can start with the exercise. So what should be done? So nurse says that First, consult your doctors and qualified dietitian, nutritionists, get your blood glucose level in control. Then you can start working out. Always check your blood glucose levels before working. If it is below 120 mg percentage before activity, have a fruits or small snacks equivalent to 115 gram carbohydrates. If it is above 240 mg, do not exercise. Have plenty of salty fluids like salted lemon water, salted soup. Bring down the blood glucose level and then exercise. If it is above 180 mg, should not do any intensive activity. So this how you need to educate the diabetic patients. This is very important. There are some scenario which I have taken. So this is about the exercise in diabetes. If you have any doubts regarding exercise in diabetes, so you can ask now. Yes, anyone has any doubts? This is a very simple topic, but in diabetic management, it has a cornerstone. It has a vital role in managing the diabetes. Yes, do you have any doubts? Dear participant, you can ask. Yes, no doubts.
No any doubts, sir.
Shall we start with the case presentation?
Yes, sir.
Yes, Sachin sir, shall we start the case presentation now?
Yes, sir.
Okay. Yes, John, are you ready? John Garde, you are not audible, John. John, you can share your screen and you can start the session. John, am I audible to you?
Sir. Hello.
Hello, you are
Am I-
audible. Yes, yes, you are audible. You can share your screen.
Yes, sir. Hello. Yes, sir. Can you open my presentation, sir?
You are going to share the screen or am I going to share? Am I?
मला आवाज येत नाही सरांचा. सरांचा आवाज येत नाही मला. Sir, I am unable to share the screen, sir. So host has disabled participant screen sharing, sir. अरे मला आवाज येईना सर काय बोलायला.
Just a minute, John. Am I audible to you? Now you are hearing my voice.
Yes, sir.
Just a minute. I'll give you the co-host access.
Yes, sir.
Yes. Now you accept the co-host access and you can share the screen now.
Yes, sir.
होते शेअर होते पोस्ट करायला पाहिजे केलं చూసారా ब्लॉक तो बाबा चेहरे म्हणून बसायला गेलो चेहरा
Am I audible? Shall we start?
Yes.
Like now. Hello?
Yes,
sir.
John,
Shall
you
I
can start. Yeah, you can start.
Thank you so much, sir.
Good afternoon, everyone. Myself, John
John
Ashok from Bharati Vidyapit University,
Sangli.
Sangli.
I will be presenting a case. Let's see the information of the patient.
Mr. X, with 55 years male, residing near Collector Office, Vijayanagar, Sangli. He was admitted in Bharati Hospital on 20th of April 24 at 11 a.m. The chief complaints were hyperglycemia, that is, BSL was 450 mg per DL, symptoms of increased thirst, frequent urination, and unexplained fatigue since last 7 days. He was diagnosed with type 2 DL, with hypertension and ISD. Past history of medical illness includes known case of DM since 8 years and hypertension and ISD since 5 years. Patient was managed with oral medications and lifestyle modifications. So the medication history included tab-glycifase with content was metformin. It belongs to class
which helps to control the blood sugar level. The dose was 100 mg for oral BD. Tab N was which content of NLFL, that was 5 mg oral. It was given HS. It belongs to class angiotensin converting enzyme inhibitors to treat high blood pressure. Tabiclosprin AV with content of aspirin plus atorvastatin. Aspirin is a NSAID and has an antiplatelet effect. Atorvastatin belongs to class statins, helps to lower bad cholesterol and reduces the chances of complication in patient with heart disease. So dose was 75 mg and 20 mg of atorvastatin. It was given per oral for HS. So this was about the medication history. Next, we'll see the family history. Patient had a significant family history as his parents were known case of DM and STN. In social history, patient led a sedentary lifestyle and due to his job, history of irregular exercise and poor dietary habits, his diet consisted mainly of processed foods. Ganesh, his screenshot. So, next we'll see the lab investigations on admission. So next we'll see the lab investigation which were done on admission. On 20th of April, the complete blood count was checked, during which hemoglobin was 13 grams per DL, white blood cells were 5,100 per cubic mm, and platelet were 3,44,000 per cubic mm, that suggested normal findings. Second, serum electrolytes, sodium was 145 millimole per liter and potassium was 3.5 millimole per liter. They suggested normal findings. Third was random blood sugar level, which was 450 mg per DL and suggested of hyperglycemia. On 21st, that is on the next day, fasting BSL was taken. It was 165 mg per DL, suggested a raised fasting BSL, and HbA1c was there. So the value was 8.5%. So this was about the lab investigations. Next, we'll see the on-admission examination of the patient. So the vital signs, temperature was 98 degree Fahrenheit, pulse was 98 per minute, respiration 22 per minute, blood pressure was 150 by 90 mmHg. General appearance, patient appeared overweight, weight was 96 kg, height 170 centimeters. The BMI calculated was 33.2 kg per meter square and belonged to obese class 1. So systemic examination, first was cardiovascular system. Patient presented with sinus tachycardia, no murmurs or any abnormal sound. A respiratory system, clear breath, no coughing and wheezing. In gastrointestinal system, on palpation, abdomen was found soft, non-tender, On auscultation, bowel sound was normal. No any sign of nausea, vomiting, and constipation was there. So in neurological system, patient was conscious and oriented. In musculoskeletal system, full range of motion, upper and lower extremities with no joint pain. Next, integumentary system, a palpable peripheral pulses with no rashes or itching. So this was about the on admission examination. So in the medical management, how patient was managed, the goal of medical management involved crucial and immediate action to lower the blood sugar level and prevent complication. So in the first part that was crucial and immediate therapy, a stat dose of injection, that is a regular insulin bolus of 10 units of dose diluted in 10 cc NS was given intravenously. It was given at 2 intervals. So as regular insulin is a short acting with onset of action of 30 to 60 minutes. So next was proton injection pantoprazole, that was from the supportive therapy. It is a proton pump inhibitor. The dose was 40 mg intravenous. OD was given. Tab metformin, it belongs to class biguanides, which helps to control the blood sugar level. It was 500 mg per oral BD given. Tab NOS, that is angiotensin converting enzyme inhibitor. That is an antihypertensive. 5 mg per oral, it was given HS. Tab ecosprin AV 75 by 20. Antiplatelet drug with statins helps to lower bad cholesterol and prevention from cardiac diseases. So it was given per oral for HS. So we have seen the medical management of the Mr. X, and still further it was managed. Continuous glucose monitoring was done. The blood glucose level monitor every hourly for 6 hours till the BSL came in control. Fluid replacement, intravenous fluid, IVNS was administered to prevent dehydration resulting from hyperglycemia. In patient education, about the importance of adherence to the diabetes management plan, including medications, diet, exercise, and regular monitoring of blood sugar levels. Next was prevention of complication. It's crucial for individuals with diabetes to seek medical attention promptly if they experience persistently high blood sugar levels, as untreated hyperglycemia can lead to serious complications such as diabetic ketoacidosis, that is DK, or hyperosmolar hyperglycemic state. So this was about the medical management. So next we see the nursing management. This involved assessment, close monitoring, intervention, and support. Here, what the nursing care included: assessing the vital signs, the neurological status of the patient, fluid intake and output, signs of dehydration or electrolyte imbalance. Next was continuous monitoring, monitoring blood glucose level hourly to ensure they are trending downwards. This is a very important point. So fluid management, infusion of intravenous fluids as per the doctor's orders, and encourage patient to take fluids and assist in rehydration. Next was medication administration, prescribed medication as ordered by the physician, that is insulin administration and oral anti-diabetic medications. In patient education on adherence to the treatment, including medication, compliance, proper nutrition, and regular exercise. Next was nutritional support, collaboration with the dietitian and development of meal plan that help regulate sugar levels while meeting the patient nutritional needs. In promotion of activity, patient was encouraged for engaging in physical activity as tolerated, which helps improve insulin sensitivity and lower blood sugar levels. Next was emotional support. Hyperglycemia may be stressful, so encourage for open communication and address any concerns or questions that patients may have. Collaborations with the healthcare team, including physicians, dietitians, educators, to ensure comprehensive care and coordination therapy. So by implementing these nursing interventions, the goal was to effectively manage the hyperglycemia and prevent the complications and promote overall well-being of the patient with diabetes. So we had on-discharge exercise plan. Mr. X was advised to incorporate regular exercise into his daily routine. A personalized exercise plan was created, including aerobic activities, such as walking, cycling, as well as resistance training, targeting major muscle groups. So the exercise regimen aimed for at least 150 minutes of moderate intensity aerobic exercise per week, supplemented with 2 to 3 sessions of resistance training. Advice was given to remain hydrated before, during, and after exercise. Also advised for being mindful with the nutrition, including carbohydrate intake, to fuel the workouts appropriately and manage blood sugar levels properly. Advice for continuing medications as per the schedule, monitoring blood glucose levels. Advice to adjust the exercise to avoid exertion and injury. Monitor symptoms like dizziness, weakness, or excessive sweating during the exercise. Stop the exercise and seek medical attention if experiencing any concern symptoms. So these were the points which were included in the nursing management. So at last we'll see the progress and results. After 1.5 months of adherence to the exercise regimen program, Mr. X showed improvements in various health parameters. First, the glycemic control. His HbA1c levels dropped from 8.5% to 7.5%, indicating better long-term blood sugar management, and BSL was in range of 130 mg per dl. Next was weight management. He experienced a modest weight loss of 3 kilograms, contributing to improved insulin sensitivity and overall metabolic health. Third, that is cardiovascular health. His blood pressure and lipid profile showed favorable changes, reducing the risk of cardiovascular complications associated with diabetes. Next was mood and well-being. Mr. X reported reduced stress level and improved mood following regular exercise, enhancing his overall quality of life. So these were about the progress and results of exercise. So this next we'll see the conclusion. This case presentation highlights the effectiveness of exercise as an integral component of type 2 diabetes management. Regular physical activity, when combined with medication and dietary modifications, can lead to significant improvements in glycemic control, weight management, cardiovascular health, and overall well-being in patients with type 2 diabetes. Studies have shown that regular exercise, along with dietary changes and medication management as needed, can lead to improvements in HbA1c levels over time. Some individuals may experience noticeable improvements within a month of starting an exercise program, while others may see a gradual progress over several months. The personalized exercise plans tailored to individual needs and preferences are essential for promoting long-term adherence and optimizing health outcomes. So this was about the conclusion of the case presentation. The books I've referred was Chintamani, Lewis Medical Surgical Nursing Assessment and Management of Clinical Problems, first edition, page number 1245 to 1522. Next book was Brunner and Sudha's textbook of Medical Surgical Nursing, 11th edition, page number 1377 to 1405. So this was about the case presentation.
Yes, do you have any doubts? If you have any doubt, you can ask. Yes, am I audible?
Yes, sir.
Yes, do you have any doubt, dear participants? If you have any doubt, please ask. Yes, exercise has many effects, many benefits. It has immensely affect the diabetic management. So because there are various studies which are available, exercise is very important in diabetic management. There are various health benefits which are available. Yes, any doubts so far? Even if you all can do the exercise, you can start with your exercise. Even my PhD study is on pre-diabetic. Continuously, if you are maintaining your diet and exercise, you can reverse the pre-diabetic also. Not diabetics, in pre-diabetic, if you are having pre-diabetic, that can be reversed or delayed of getting diabetes in future. That's why the diet and exercise are very important in your day-to-day life. Yes, is it clear? You have any doubts? If you have any doubt, please ask. Otherwise, I'll send the feedback link in the chat box. You can.
No, sir, no
Just a
any
minute.
doubts.
Just a minute. I'll send the feedback link in the chat box so that you can share. Yes, you can check your chat box. You can fill the feedback form. Please, without filling feedback, please don't leave.
Participants, please fill the feedback form. The link is shared by Vishal sir in chat box. Everyone has to fill feedback form.
Yes, please fill the feedback. Till now, 5 responses I got.
Please don't leave without filling feedback form.
Next session is on monitoring of diabetes. For that, the speaker is from Pune, Subhangi Gaikwad madam. She is going to take that monitoring of diabetes.
अरे काय आवाज नाही येत मला कायचा आवाज येत नव्हता
Till now, only 8 responses I got. Please fill the feedback form. Later on, I will share in the WhatsApp group. You can fill the feedback form.